And speaking of guests, we have a very special person on today. Uh, this is a colleague and a dear friend of mine. Her name is Barbara Abruzzo. And her story is going to be a very interesting one, an inspiring one. We always talk about the different parts of what our program is about. One is to show the heart and soul of the healers, and she certainly has a heart and soul that you will see. And she's gone through a number of healthcare issues throughout her life. So we're going to learn many things today about healthcare from every point of view. But I think the thing that's most interesting for me is I know that many people talk about healthcare and how it needs to change and how it's broken and all of these problems that they have with it. Well, Barbara is one of the true pioneers in making change because of all of her experiences. She is at the forefront of helping to change the way the system works and the way people can benefit from that. So I don't want to waste any more time. I'd rather be talking with her than listening to myself. But I could talk for hours about her. So I would like to, at this time, introduce our audience to Barbara Abruzzo. Christina, Barbara.
Hello, Barbara. Thank you for honoring us here at YHTV.
Hi, Christina. Hi, Glenn. How are the both of you?
We're doing great.
That's great. That's great.
Barbara, there's so many parts that I want to talk about, but as a medical guide, I always like to start out the show telling people the path that we may take. And I know in this case that our path will probably change from what I even think we're going to do today. But the first part I want to talk about and get to know you a little bit as we go through your whole journey in a timeline. The first question I have is, when, why, how did you decide to become a healer? That's the important part for me at the beginning here. So could you talk to us about that for just a few moments?
Sure. So I've been in the healthcare system actually my entire life. From the time I was a little girl, I had orthopedic issues. I thought they were just orthopedic issues, but as a 9-year-old, I had orthopedic surgery on both my ankles. I had ankle fusions. And then 3 years later, I was hospitalized. I had scoliosis and I had a full thoracic spinal fusion with a bone graft. And I was in a body cast for a whole year flat in bed when I was only 12 going into 13-year-old. So it was very much a character shaper for me. And, I was fine throughout all of that and remained very functional, although I had some limitations. I certainly was never going to be a track star, but I had, some limitations. And I had always wanted to be, I was very interested in psychology and wanted to become a clinical psychologist. And as things unfolded, I became a registered nurse and wound up working in neonatal intensive care for 5 years. And ultimately, that's how I wound up to become a healthcare navigation specialist, that I really looked at what was I really doing, and I was helping people safely navigate the system to find the right and best care.
And we're going to speak more about that in a few moments as we move on with your journey. I want to talk about, you mentioned the word infestation a little while ago.
Oh, and my little infestation. Okay.
And
the little, she says the little.
Starting with a little baby tick bite. Such a teeny weeny little tick bite introduced a bacteria into your system. Yeah. How old were you when this happened, approximately? Or how many years ago? That's another way of asking.
It was 9 years ago. And so in 2003, I was living in the Hamptons and had a beautiful, magnificent 2 acres of gardens, most beautiful gardens. And I was also spraying, having people spray rosemary oil, which is a natural way to kill off the tick population, and had deer fencing up. Even though a family of 5 used to circle my property like 3 times a day, wanting to come in, it was like for them, it was like having a little cocktail party on my property. And but it's not just the deer; it's the neighbors' cats and rabbits and foxes and mice and birds. Everybody, any animal that's coming onto the property was carrying ticks. That it's pandemic in the Hamptons as well as on the Northeast coast now.
It's also on our coast.
Really,
Yeah,
really.
more in Northern California, but it's also made its way to the West.
And also I knew about the Northwest, but not as far down as you live, Glenn, right?
Hopefully.
Yeah. Because so when I didn't know, I mean, I was aware because I was seeing a lot of patients with Lyme at that time, and not patients who were bit and found the tick and had a bullseye and they were treated and fine, but patients who never knew they had Lyme, so they were walking around with chronic Lyme but being misdiagnosed with multiple sclerosis or even ALS, Lou Gehrig's disease, and many other things, cardiac disease and arthritis, when what they had was Lyme disease. And as well as people who just didn't know what was wrong. They were just very fatigued. They had arthritic pain. They had cardiac symptoms, or they had neurological symptoms. And many of the doctors in the Hamptons only followed the CDC protocol, which is that you put a patient on 1 month of doxycycline, and that's it. That's the treatment protocol. So they don't ask the doctors to do a clinical diagnosis because many patients test negative for Lyme. There's a lot of false negatives, and I was one of them. I had been tested 7 times as I complained about having ridiculous fatigue, like ridiculous. I could barely climb steps. And I kept testing negative. And then I wound up with very severe neurological symptoms over a weekend. I never get headaches, and I had a splitting, literally like somebody took an axe and split my skull open, type of headache for 3 days. And I was taking ibuprofen, very high doses, and it wasn't touching it. And I called my friend Floyd, who's a neuro-ophthalmologist, and said, Floyd, I've had this killer headache, and I think I have Lyme. And he was like, Lyme? He said, you could have a brain bleed. You need to get to a hospital right now. So I said, don't you think that's overkill, Floyd? And he said, really? Because if I'm right and you're wrong, you're going to be dead in 24 hours if you don't listen to me. So I said, well, I'm not going to Southampton Hospital because I will never make it out of there alive. And I came into the city, and he did a scan of my brain at New York, NYU. And thank goodness I didn't have a bleed or a tumor. And he tested me for Lyme and the co-infections. And 4 days later, he said, not only do you have Lyme, but you have babesiosis. So my little tick was carrying Lyme and one of the co-infections. And I never found the tick or never had the bullseye. So I didn't know how long, prior to my being tested, I had been bitten. And my sense was,
let me interrupt for 1 second, Barbara.
Sure.
Just for our audience, when you're saying the target, that's a skin lesion that usually comes up at the site of the initial tick bite, where it looks like a target with a reddened area, and the center sometimes looks very clear or white. So we call it a target lesion, and sometimes that gives us an indication that we need to look forward more into the diagnosis of Lyme disease.
Oh, yeah. I mean, there are people who, like, even the gardeners who work out there, they would come home from a day's work and they could have 50 ticks on them. So they would make sure they would take a shower and they check. Ticks like to hide in dark spaces, like between your toes, behind your knee, in your groin area, around your umbilicus, around your belly button, your armpit, behind your neck. They like to be in places where you wouldn't find them, so you can't, because when they attach, it takes a couple of days for them to, draw out the blood and then transmit the the release of the spirochetes that could, if they have them. Not every tick is infected with Lyme or any of the co-infections, but there's so many ticks now out in the Hamptons where they are infected with Lyme and the co-infections. They're seeing so many more patients with co-infections now. And once you have a co-infection, because like the one that I had, the babesiosis, is like having malaria, and the spirochete will trick your immune system. They've been around since before the dinosaur. They've survived, and they trick the immune system to not fight back. They literally trick it to not engage so that they can keep proliferating in your body. And it happens very, very, very quickly. So it's, but in terms of the type of bite, a tick in the early spring is so tiny, you can take a pen and just put a dot on like a period on your hand, and that's how tiny it is. It's like a period at the end of a sentence. So for you to even be able to see it would be almost impossible. And then later in the season, as you get towards the fall, they start to get a little bit larger. And so you can really see them once they're on your body. But for some people like myself, even when they're bitten, you don't get the bullseye, which Glenn explained what that looks like. It's like it almost looks like a black and blue, and then it has a larger circle around it. It looks like a bullseye, the way if you were shooting darts or arrows, and that is pretty indicative that you've been bitten by a tick.
Keep us going on your journey in terms of the diagnosis, and then all of the things you did for healing, where you went, traveled, doctors you worked with.
So once I was diagnosed, my friend Floyd was not going to treat me. He's a neuro-ophthalmologist. He had just done me this favor, and I was back out in the Hamptons, and I contacted a local internist there, and he wanted to put me on doxycycline, like the standard CDC protocol. And I really resisted. I knew about this Dr. Borascano, who had really saved, he was no longer practicing, unfortunately, in the Hamptons, but he was this brilliant pioneer who was seeing so many patients in the Hamptons that were really decompensating, like they couldn't walk. They were in wheelchairs. They looked like they had multiple sclerosis and ALS. They were actually diagnosed with these things. And he started treating them, and they tested negative for Lyme. He started treating them with major doses of multiple antibiotics intravenously and then orally, as well as doing a number of other things. And he developed this protocol over 20 years. There were people who came into his office in wheelchairs and ultimately regained their ability to walk again, because they were treated incorrectly for years, like with multiple sclerosis. They were on multiple sclerosis drugs, and yet they had Lyme the whole time. So the Lyme was proliferating in their bodies and taking over, and nobody was treating them for that, and they were being treated incorrectly, misdiagnosed, and being given medication that they didn't even need for multiple sclerosis. And so I wanted to follow Borascano's protocols, and this doctor said that he wasn't willing to do that. And because I came into the world with this neurological disorder, it's a nervous system disorder that affects the peripheral nerves, the long nerves in the body. I felt that that was my weak link. It is my weak link, nervous system. And I told him that I was already having neurological symptoms, that not only did I have the headache, I am brilliant in math. I had gotten like hundreds on my calculus regents and exams and had taken, and now I couldn't add simple numbers. I had also taken Skip Barber racing lessons. I had been driving a stick shift. I learned on a standard shift, a little MG midget, and I was a very good driver. I couldn't even get on the highway. I couldn't merge with traffic. I was very frightened. Like my world was getting smaller and smaller. I was having a very hard time managing, and I couldn't spell. And I'm an avid reader. I have a great vocabulary. I have no problems with spelling, and I couldn't spell simple words like muscle and protein, even though I'm a licensed healthcare professional. I knew what was wrong, but I didn't know why it was wrong. And before I was diagnosed with the Lyme, I had even gone to Columbia Presbyterian to be tested. I thought maybe I had early onset dementia. That's how frightened I was, that something was very wrong with me. And the doctors that I was talking was saying, oh, it's just aging. I said, first of all, I'm not that old. And I'm telling you, this is not aging. Something is wrong with me. And so ultimately, when I found out it was the Lyme, I said to him, you need to put me on intravenous now. I want to be put on rifampin. I want you to follow this protocol. And he finally agreed. And I said to him, look, I'm just telling you, if you can't do it, you're not willing to do it. I have many friends who are doctors that will prescribe the medication for me, and I'll just get the intravenous. It was a home care intravenous where they deliver the IV bags and the nurse comes and starts the IV. So I did that for a month, and I was on Mepron, which is a drug for malaria, which they use to treat babesiosis, as well as many supplements and special diet, like you should never eat sugar. Now, this is Boroscano's protocols, because the Lyme spirochete loves the sugar. It just keeps the infection mobilized. So you need to not have any sugar or alcohol or simple carbohydrates. And you need, even though you're tired, you need to be exercising as well as resting, but a lot of supplements, like about 15 different supplements, very specific to the treatment of Lyme disease. You need very high doses of coenzyme Q10 and alpha lipoic acid and magnesium and calcium and, of course, a multivitamin, essential fatty acids, D3, like that. And certainly probiotics, because you're on so many antibiotics. And then I was on oral antibiotics for almost a year until I had no symptoms. And then I was fine for a couple of years, but it's a chronic situation now, unfortunately, because I never found the tick. And I never had the bullseye. I was hoping that I had gotten it in time and that we were very aggressive with the treatment and that it wouldn't turn into a chronic thing. But a couple of years later, my symptoms came back, and then I was treated. I saw a biological medical doctor in New York who was doing these intravenous therapies using sodium chlorite. So that's not chloride, IDE, but chlorite, ITE. And it was almost like putting Clorox in my veins. It was very detoxifying, very challenging treatment, but it worked. I had 10 treatments, one a week. And then I was fine for 2 or 3 years. And then the symptoms came back again. So I just came off of 8 months of antibiotic therapy. Had Glenn contacted me 3 months ago, I could never have done this interview. I just would not have had the energy to do it. So this is just something that needs to be managed. And I help many, many patients with Lyme disease manage their process.
You also went to Europe
Oh, I did. I went to the Paracelsus Clinic in Europe. So that's Thomas Rao. That's the clinic I had told you about. And I had gone there every year, 2 to 3 times a year, through from 2003 to 2008. And that helped dramatically because, again, they're doing their classic treatment is they do live blood cell analysis, and then they do these IVs, as I told you, with the Heal and Sanum remedies and high doses of vitamin C and micro minerals. And you get colonics and body work and energy work, and they use this indeed. But a lot of treatments are not available in the States. It's just an amazing place. You're in the Swiss Alps and you're staying at a bed and breakfast where they're cooking all the organic food for you. And you go to the clinic every day. They have a little shuttle that runs back and forth. It's just a few blocks away. And it's really an amazing place. I send a lot of patients there for treatment for cancer and different types of chronic disorders. And they do remarkable work. Unfortunately, Thomas Rao has sold the clinic, so he's there, but he's only there on a limited basis. And it's really Thomas who, when I go, I would insist on seeing him because I feel that he's a master and just a medical intuitive, and really he's just a brilliant doctor. So all of this has helped. If anything, this last round of treatment, the doctors that I'm seeing locally said, we've never had anybody whose chemistry profile, like all the tests that they do for the Lyme, look this good. But the reason why mine looks so good is that I had been doing the treatment protocol from the Paracelsus Clinic all along. It's just that the bacteria will just, it gears up again, So now everything's dormant, thank goodness. So I keep praying that they're going to come up with a cure for Lyme.
It's an amazing story, and I've been with you at certain times when it's been painful and a number of challenges, and you always seem to rise above those challenges through your spirituality, through your knowledge, through your discipline, everything. It's pretty amazing. I'm grateful to my very special guest, Barbara Abruzzo, for sharing her wisdom and experience, an amazing experience with all of the things that she has done and continues to do for all of us in terms of the healthcare experience. I want to thank all of my teachers and all of those that have helped me in my healing process so that I may continue on my journey. I look forward to seeing everyone next week as we travel through another section of the healthcare galaxy. So until that time, thank you so much, Barbara and Christina, and I wish everyone optimal health.
Thank you. Thank you, Barbara. You are such an inspiration to so many, I'm sure, for this Lyme disease and everything else in life. Really, you've gone through such a great journey, and we really appreciate you honoring us with sharing so much of it. And we look forward to having you back on again.
Oh, thank you. Thank you so much. The both of you, really, it was a pleasure.
Thank you. And we would like to thank each and every one of you for joining us on this new platform of education and information. We're grateful for your continuous support and look forward to hearing from you of your feedback and how we can serve you better. We invite you to join us live Tuesdays for Magical Medical Tour at 10:30 a.m. Pacific Standard Time, 1:30 Eastern Time. Wednesdays for Trinity of Life at 11 a.m. Pacific Standard Time, 2 p.m. Eastern Time, followed every other week with Flowing into Awareness with Anatara. Until we meet again, namaste.